It's been a while. I have been with CEI for a couple of years now, since 2018, I think, and I've really enjoyed coming up with discussions over the years. And so, my background is in internal medicine. I now work full time in addiction medicine, but I also have split my time in. I also worked with the city of Chicago, where I live now, and worked within the wards in order to work in public safety. And I also worked in Rochester doing the same thing. One of the things I like to do with my discussions is to fold in policy work or policy political discussions into, or at least how policy shapes kind of what we're doing as providers and people that care for people that use drugs or people with HIV. And so you'll see a lot of historical context here, especially with this topic. This has been on my heart for a little while just because of you know, the way that substance use has impacted communities like mine and communities, across the country. And so I tried to put into words, why it is that people, communities are resistant to treatment, especially or treatment modalities that they don't understand or may not know or may not feel comfortable with, if especially when there's so much need. And so hopefully we can talk about that today and get a realistic point of view on that. So let's get started. Next slide. Okay, I do not have anything financially to disclose. Go ahead. All right. So the learning objectives today are going to describe historical, structural, and policy-related factors that shaped mistrust of health systems among Black, brown, and marginalized communities, especially in HIV and substance use disorder care. We're going to analyze how past and current public health strategies, including surveillance-based interventions and criminalized drug policy, have contributed to community resistance while comparing successful community engagement models in HIV care with an ongoing challenges in substance use engagement. We're going to review evidence-informed, community-centered engagement strategies to redesign and strengthen programs to build trust, reduce stigma, increase participation, and promote health equity. Next slide, please. All right. Okay, so before the war on drugs, we had two different standards of how the United States dealt with opiate abuse, right? We're now thinking of the turn of the century, right, when we had people coming back from the war. And we had people coming back addicted to morphine, right? I mean, there's a lot I could say about how the country dealt with opiate addiction. But for the sake of this slide or for this discussion, I'm just going to be a little bit broader and just saying that, like, we had, it just depended, honestly, on, we're going to talk about barbiturates, right? So turn of the century, 1914, we had barbiturates that were easily prescribable. It was easily accessible due to what medical doctors were willing to prescribe and had little oversight, regulatory control at the government level, federal government level. 1950s barbiturates were known as mother's little helper, right? I'm sure people have heard of or know of that saying. Opiate abuse just really depended on who you knew, right? If you could hop doctors without any problem. And there were a lot of overdoses that happened in those years due to that issue. 1940s, 1950s, there started to be a little bit more oversight into 1950s specifically, when more people started dying that were well known. We know 1962 is when Marilyn Monroe passed away from barbiturate use, but there was starting to be more regulatory control over those issues. But in the meantime, during that time, 1914 on, we had newspapers that were continuously reporting that Black and brown people on drugs were, quote, crazed and sleeping at work under the influence of cocaine and marijuana, right? We had, and I'm sorry, I'm going to mention some racial tropes here, but we had, like, shiftless folks, and we had other groups that were being portrayed as lazy. And so, one of the things I remember as a kid is Looney Tunes, and that there were still pretty racist Looney Tunes out there that were being shown on TV. And so you got to see some of those racist tropes, especially when identifying with Black and brown people. So we have 1971, where Richard Nixon declares a war on drugs, citing drugs that were coming in from the country legally from Mexico and other countries, declaring that addiction to drugs like cocaine and heroin, which is what he was after, not barbiturates, right? Maybe it came under the umbrella. They were becoming a national emergency. 1973, the DEA was started, Drug Enforcement Agency, federal agency tasked to investigate illegal drug use and smuggling into the United States. Nixon officials specifically mentioned two enemies that they're at the time during his campaign in 1968, were specific communities of people that the administration wanted to disrupt. So John Ehrlichman, who eventually went to jail for his participation in the Watergate scandal, was talking to a magazine in 1994. And I will quote him by saying, you know what this was all really about. When the Nixon campaign in 1968, they had two enemies, the anti-war left and Black people. You understand what I'm saying, he says. We knew that we couldn't make it illegal to either against war or being Black, but by getting the public to associate with hippies with marijuana and Blacks with heroin, we were criminalizing them both heavily, and we could disrupt those communities. We could arrest their leaders, raid their homes, break up their meetings, and vilify them night after night on the evening news. Did we know we were lying about the drugs? Of course we did. Ehrlichman is referencing that by using the war on drugs in order to justify the need for building a racist structure, systemic racism, in order to villainize certain groups of people, the result was, as we see today, substance use as a lot of the time, you're going to hear me say this a lot, but as a dog whistle in politics and in society. Next slide. Right. So we talk about the incarceration and the war on drugs. And within the start of this new federal policy, incarceration rates increased exponentially from the 1970s onward. We saw that under Ronald Reagan, nonviolent drug offenses became the major driver of prison sentences. Black Americans were disproportionately arrested and sentenced. Incarceration and its long-term effects were unemployment, families, and housing discrimination, loss of housing. Under Ronald Reagan, the number of Americans that were in prison under the war on drugs was around 2 million, which was the highest rate globally at the time. Black Americans were incarcerated at the rate of 5 times of white Americans. At one point during the 1980s, it could be said that 1 in 3 Black Americans, or Black men specifically, could be expected in their lifetime to be incarcerated. Marijuana enforcement became also a front door to the prison system, especially for young people. Between 1990 and 2008, there was the zero tolerance shift, creating a 113% increase in incarceration or arrests. We're going to go ahead and move on to the next slide.